Often we'll get the inquiry or we'll get a phone call, and the question is whether or not it's safe to travel to get plastic surgery. I would say, we see people from out of town, and a lot of the things that we do on the front end, we leverage our electronic age where we can do video, HIPAA compliant consultations, pictures, things like that, garner preoperative clearance before meeting the patient. A patient can then arrive, but we will have to have some of that time where we lay hands on people, do photos and measurements so that we can make sure that we're all in the same place. And then once that surgery is done, there's a period of recovery where you need to kind of be on a short leash and plan to be in the local area for the safest possible outcomes. A lot of times we'll see you the next day or 24 to 48 hours later, and then we'll see you a week later, answer all those other questions, and we'll be able to cut you loose. I think then we can talk about how follow-ups go beyond that. Some of them are simple, Q&As that we can do over those HIPAA compliant applications, or you can come on back and we're always love to see you. I think one of the concerns is it safe to travel outside of the United States? Where we are down in the Southwest, people like to travel to Central America. And I think the challenge there is that we don't really have oversight on how things are done there. The standard of care is not as clearly defined. And sadly, we do see times where we're seeing patients who have gotten care, they're either unhappy with it or it's left them with results that are not where they'd like to be. And the challenge there is kind of going backwards, trying to redo what's already been done. And a lot of times we can do in plastic surgery, but it's very difficult to undo. So I think I'd be leery in saying that, hey, just because it's cheaper somewhere, I'm going to travel there. Again, this has everything to do with your confidence in the office, your confidence in the surgeon, their training, and the reliability of that follow-up that comes thereafter. So although it is not a super common thing that we see, we're more than happy to see people from out of town. And really what we think about is we feel honored that they would come as far as we've had people even from Boston and the East Coast that trust us, knowing that we're going to take care of them and be part of their care from beginning to end.